For over a decade, the City of Richland has been working hard to improve our central business district. The CBD is comprised of 4 distinct areas: the Parkway Business District, the Uptown Business District, the Medical District, and the Government District. The heart of the Central Business District is Swift Corridor, and City Council identified it as the first area to redevelop within the CBD.
And the reason for that was they noticed that Swift Corridor was a place where there had already been a lot of investments. You had Cadillac on one end, who was investing a lot in the medical district. We just recently had redone our library and created this beautiful setting. And so they said, well, let's focus on Swift Corridor. We've already made a lot of investments there.
Cadillac is the largest employer within the Central Business District, and over the past decade, Cadillac has evolved into a regional medical center.
We're serving patients not only in the greater Tri-Cities area, but because of some of these specialty services that have been added, such as cardiac and neurosurgery, and we've always had the specialized children's care, we're now seeing patients that come from as far away as Hermiston and Pendleton and up into the lower Yakima Valley and down into Walla Walla and east of Walla Walla. So the key has been is how do we grow as a healthcare organization to be able to meet the needs and the demands of the people that want these health services, not only here in the Tri-Cities, but outside the Tri-Cities that are coming here for their health care.
When we look at economic development, it's really about bringing investments into your community. Cadillac's really important to this community. The growth of the hospital has changed how this community is represented. When you look at redevelopment, it's really about people. You have to get people into your central business district for us or into your downtown. Cadillac's a major draw, and one of the few draws we have within the central business district. They have a number of employees as well as a number of patients and people coming to see the patients. And they're 24/7, so people are coming in and out of the hospital at all times. So that's bringing a lot of people into our central business district. So they're really key in our economic development plans and in our redevelopment plans, and we're trying to do those things that will help Cadillac grow.
Most people are familiar with Cadillac's current campus on Swift, but over the past several years, they have expanded down Stevens, Goethals, and Lee Boulevard. In fact, their campus master plan shows the hospital growing east on Goethals, and now Cadillac is asking the City of Richland to vacate about a 500-foot portion of Goethals between their new medical facility and Dr. Yang's office. Northbound traffic on Goethals will still be able to access Lourdes Counseling Center, Hapo Community Credit Union, and Dr. Yang's office, and access to Swift Boulevard is available by turning west on Gilmore Avenue. Cadillac will be required to construct a city street to connect Jadwin Avenue and Gilmore Avenue. If Cadillac's vacation of Goethals request is granted, they will be required to complete the Jadwin-Gilmore connector street before Goethals is vacated.
And so what we're trying to do is balance the pedestrian needs and the patient needs as well as the traffic needs for the residents of the City of Richland to make it best for all needs, but most of all, make it safe for our patients to cross the street whether they're accessing services on either side of Goethals.
As part of the vacation of Goethals proposal, the City of Richland required Cadillac to conduct a traffic impact analysis to determine how the road network would function if Goethals Drive was closed and a connector street between Jadwin Avenue and Gilmore Avenue was constructed. Cadillac was able to pair their findings with a Swift Corridor traffic study that was completed in 2011.
Essentially, the results of that are that some of the movements actually work better with that connection piece in there between Gilmore and Jadwin, and the rest of it doesn't really work any differently. Therefore, there's benefits to having that closed as far as pedestrian safety and just to make a nice walkable campus facility. It's a pretty major piece of downtown, and so those benefits, when we look at it, kind of outweigh, some of the negative aspects of, closing that portion of Goethals.
I think the bottom line is we want to be a good neighbor, and we want to be able to continue to provide the type of healthcare services that Cadillac has been known for through the years, and we want the community to be proud of having Cadillac in this part of the community, in this part of the Tri-Cities. And we also want to make sure that we're having a campus that can be safe and accessible for our patients and staff.